Secretary Squier, you said that the Medicaid system in New Mexico is unsustainable. Could you tell me a little bit more about that?
Yeah, I believe that that's true. I think if you look at our budget and what happened in the last session, you'll find that both the legislature and the governor's budget had to add more just to meet our budget. And we are growing. Our costs are growing. Our enrollment is growing. So that doesn't even count what we predict is going to happen in 2014, when we're going to get 130 to 175,000 new enrollees. We're predicting that's going to cost $330 million to $360 million. And then let's not forget that what's going on at the federal level right now. And they are talking seriously about cutting, and Medicaid is on the table. So all the promises that the feds have made about money that's coming to the states, I think we need to be cautious, optimistically cautious for sure, but cautious about whether or not all that money is really going to come to us.
Why do you think that money may not come?
Well, if you've been reading the papers, which I know you have, then you know that they've got this bipartisan commission now that's set up to come up with $1.5 trillion in cuts, I believe it is, and everything is supposedly on the table. And originally, when they were just talking about the deficit, they were saying no Social Security, you can't touch that. No Medicaid, no Medicare, you can't touch that. But they never said anything about not touching Medicaid. So I think we just have to be careful about spending. And even if we didn't have healthcare reform, Obamacare, this program would increase by 20% by the year 2019. And we just don't have the money. I mean, where is the state getting that money to do that? So part of my goal is to reduce costs, or at least bend that cost curve, because I think it's absolutely unsustainable the way it is, regardless of other arguments that you hear out there. I see the monthly projections every month, and I'm telling you, we can't go on with it the way it is.
So you're trying to save it.
You betcha. Preserve it for future generations. Absolutely.
But it's like the third rail of politics, and I guess the third rail of healthcare too. When you even bring up the idea of making changes, people go nuts.
Yes, and I'm aware, because I was party to them going nuts. And I think that people have the impression that when I say making changes, I automatically mean that we're going to make cuts. I don't automatically mean that. As a matter of fact, we have not put forward any cuts so far, even though if you sit through any of the public hearings, that's all we heard, is that you're going to make cuts, you're going to take away our benefits. We're not suggesting that we do that. I'm not here to promise you today that there will be no cuts, but I'm not looking to make cuts, specifically not cuts in medical necessary services. The governor does not want to do that. When she doesn't want to do that, I don't want to do that. So that we just have to look at a different way of doing things, and it doesn't necessarily involve making major cuts.
What about co-pays?
Well, I'm interested in co-pays. I'm looking at them. I think there's several other states that are already doing co-pays. I want to do it on a sliding scale for those who can pay. I think we're have generous benefits here in New Mexico, so there's people that make some pretty decent money that maybe could afford a copay. We also need to do something to disincentivize folks from using the emergency room for non-emergency services. They have got to get out there and get themselves a doc that they go to instead. Now, if it's an emergency, nobody wants them to run to that emergency room more than I do. But that's not the way the emergency rooms are being used now. So we want to do something to disincentivize that. So copays are in play. They are on the table. But I don't want everything to be just the stick. So we're also putting forward something like an account that Medicaid recipients, enrollees can have, that when they meet, for instance, when they take their kid to get their vaccines all on time, or if they go to their prenatal care on time, and if we could find a good way, and we've actually heard a couple ideas that we might look at, of people stop smoking or losing weight, that we could put money that we would save from having to treat the chronic diseases that they get from that we would put into this account. Now, it's not cash. They couldn't take out cash, but they would be able to use this account for things that Medicaid doesn't cover, such as that copay that we were just talking about. And also, I think very prevalent is over-the-counter medicines that Medicaid doesn't cover. So any kind of medical thing that Medicaid doesn't cover, they would be able to use that for. So I do want to institute perhaps copays. We're really looking at that. I'm not going to shy away from that. But we also are looking for something to reward people for good personal responsibility.
Well, the political reality is that you're going to be sticking your head in the lion's mouth.
I'm already there.
Yeah. So what do you say to those people that say we don't want any changes whatsoever?
Well, I mean, the problem is the program has to change. It will change. If we do nothing, the program will change in ways that they don't like. So yes.
Such as?
Well, there will be severe cuts, I believe, if we don't do something to change the way the program's run right now. So, I mean, then they're all going to take across-the-board cuts. A copay will look like nothing if that happens. So, that, I think that is the reason that they have to understand that it just can't go on. And I know many of them just really believe it can go on definitely just the way it is. I do not believe that.
Also, this is a political thing where you've got Democrats, liberals who think anything that a Republican or a conservative brings up, or a Republican or a conservative administration brings up, is necessarily anathema. How do you deal with that political reality?
Well, I think it's rather interesting that both Republican and Democratic governors have appealed to the Obama administration to do federal reforms to give more flexibility so that they can run their programs the way they see fit. I admit that Republicans are leading the charge, but there are a lot of Democrats that see their budget, like this budget here in New Mexico, in 2012, that's right, 16% of the budget is going to be for Medicaid. 16%, and that's huge. And in other states, it's more. And some Democratic governors are dealing with the exact same problem. So they're appealing to the federal government for more flexibility. Let us run our program as we see fit. Let us out from under the layers of bureaucracy. I'll tell you, CMS code and regulation is as bad as the IRS any day of the week. So we want out from under it. Right now, the federal government runs Medicaid, 50 states, all the same. They're all the same. Well, New Mexico's not the same as other states. So we don't want to run it the same way you run Massachusetts or Florida or Idaho. We want to run it the way we know how. And I say the legislature and the policy people and the governor and some of the advocates know how to run it better than Washington, D.C. does.
Last question for you. This is obviously going to be an uphill climb, trying to convince people that don't want changes. On a personal basis, why did you decide to take this job?
Well, there's a lot of reasons why I decided to take this job. One reason was that my husband and I have wanted to come back and live in the Mountain West for quite a while. So we've been looking for opportunities that would get us here. That's one reason. The second reason is that I had always wanted in my career to be a cabinet secretary. All of my resume has been working for that. And I had considered a cabinet secretary job to be a career topper. But the most important reason is that there are things I needed to get done. There's things that I believe have to happen. For instance, preserving the Medicaid program. I believe it needs to be preserved. We need to keep it. There are people out there that need those services. And if somebody like me doesn't get in here and try to do something about it, if it just goes on the status quo, as it was before, then we wouldn't be able to preserve it. So there are things that I felt that needed to get done. Do I think it's a hard job? I do. Is it rewarding? Absolutely.
All right. Sidonie Squier, thank you very much.
Thank you.